Hello everyone, my name is Paola Mosquera. I'm an emerging voice from Colombia. I'm going to talk about the contribution of the primary healthcare strategy to improve health outcomes in Bogota. I will introduce the topic with an overview of the Colombian health system and about why the case of Bogota is special and deserves to be studied. Colombia has a highly segmented and fragmented national health system based on insurance market, with different regimes of affiliation that divide the population according to their ability to pay. We also have different public and private managers and providers combination, different packages of benefits, and a division of the provision of individual and collective services. This approach within the health system has created barriers to access, particularly for vulnerable groups, and has produced an overall deterioration of the health service delivery. As you can see in the pictures, hospitalization could happen in waiting rooms or halls. But what happens in Bogota? In 2004, it was elected for first time a center-left government, and they decided to reinstate the primary healthcare principles as one of their strategies to improve the health status of the population. This initiative was possible due to the local level of decentralization into the Colombian health system. What makes special the case of Bogota is that the strategy emerged as a purely local effort without receiving neither political nor technical support by the national health system and within the context of constraints imposed by the insurance market. The core of the strategy, from the operational point of view, is the home health program. The program works in all Bogota localities, and its intervention began by prioritizing the poorest and vulnerable people. The program is based in the organization of multidisciplinary healthcare teams, comprised by a physician, a nurse, an environmental technicians, and 2 community health workers. They work with 1,200 families assigned, and some of their activities are the characterization of the communities at the neighborhood levels, and the characterization of families and individuals at the household level. With the characterization, healthcare teams identify population needs and design specific action plans according to the situation of the community. Healthcare teams also provide extramural service when it's necessary, and they refer people to the intramural service, facilitating the access to the health system. In this context, in where the two different approaches coexist, we found an interesting gap to fill since there were not studies that analyzed the experience of the implementation of the primary healthcare strategy in Bogota. So, taking into account that one of the main goals of the primary healthcare strategy in Bogota is the improvement of the health status of the population, we thought that we should analyze the contribution of the primary healthcare strategy to the improvement of health outcomes in Bogota. Then we went to the methods. We designed a longitudinal ecological study, taking 16 of 20 localities as the unit of analysis. As dependent variables, we choose sensitive indicators for primary healthcare interventions. As independent variable, we construct a primary healthcare index. As a control variable, we take the severage coverage, the health system insurance coverage, and the quality of life index. The primary healthcare index was constructed by using a principal component analysis, and the index summarized 4 variables: the coverage of the characterization of the home health program, the physician ratio per population, the nurse ratio per population, and the community health workers per population. According to the behaviors of the primary healthcare index scores, localities were classified into 2 groups. The blue line represents the group of localities that showed a consistent increase in the primary healthcare index, and the red line represents the group of localities that have an initial increase but then a decrease in the primary healthcare index. This different behavior in the group was due to the level of decentralization and the level of autonomy that localities have to implement the strategy. With these 2 groups, we made a comparisons by using Poisson regression models. one for the year before the implementation of the strategy and one for the year after the implementation of the strategy. Then we conduct a panel Poisson regression model to figure out the relative change between the two periods of observation. We found significant change in some indicators. That means that a high coverage of the program is related to the decrease of 13% of under 5 mortality, 37% of infant mortality due to pneumonia, and an increase of the 5% of the DPT vaccination. Those findings make us think that some interventions offered by the primary healthcare strategy are helping to improve the population health status. The key point of our findings are that the suggestion that even in adverse contexts such as those persistent in Colombia, it is possible to improve the health status when primary healthcare is prioritized in the political agenda. We are still conducting additional research to disentangle what factors facilitated and what factors constrained the implementation of the strategy in the group of localities. Thank you very much to the research team and to our funders and you for your attention.